How to differentiate vaginal infections. BV, yeast, and trichomoniasis, medium. To properly manage vaginal infections, it is crucial to comprehend the distinctions between the most prevalent forms, namely yeast infections, bacterial vaginosis, and trichomoniasis. Every illness exhibits unique symptoms, alterations in pH levels, diagnostic examinations, and therapy methodologies. This video will provide guidance on managing acute, recurrent, and chronic vaginal infections, as well as offering insights and advice on follow-up care. Vaginal yeast infection. Yeast infections occur due to an excessive proliferation of Candida fungus. Common symptoms encompass pruritus, erythema, edema, dyspareunia, and a viscous, milky excretion resembling cottage cheese. Acidity level, pH. Vaginal pH is often unaffected by yeast infections and typically remains within the normal range of 3.8 to 4.5. Testing. There are readily available yeast infection tests that may be purchased without a prescription. These tests primarily assess the acidity levels in the vagina. To obtain a conclusive diagnosis, it is advisable to undergo a laboratory test or consult a healthcare professional. B. Recurrent infections. Prolonged administration of antifungal medication may be advised. C. Persistent infections. A healthcare provider may suggest an extended duration of treatment or examine any underlying issues. Advice and subsequent actions. Regularly practicing proper genital hygiene and refraining from exposure to irritants can effectively prevent the occurrence of future episodes. Post-treatment care may include evaluating symptoms and the effectiveness of the treatment. Bacterial vaginosis, BV. Symptoms. Bacterial vaginosis, BV, is distinguished by a malodorous scent resembling fish, a discharge that is thin and can be gray, white, or green, as well as vaginal irritation or a burning sensation, particularly during sexual intercourse. Acidity pH level. Bacterial vaginosis, BV, is characterized by a vaginal pH level that is higher than 4.5. Evaluation over-the-counter, OTC, pH tests can indicate the possibility of bacterial vaginosis, BV, if the pH level is higher than normal. However, a conclusive diagnosis necessitates laboratory testing, which include a detailed analysis of vaginal discharge under a microscope. B. Recurrent infections. Prolonged administration of antibiotics or alternate treatments may be necessary. C. Persistent infections. Probiotics and modifications to one's lifestyle, along with medicine, can potentially aid in the management of symptoms. Advice and subsequent actions. To minimize the likelihood of BV, it is advisable to abstain from douching and engage in safe sexual practices. Follow-up is crucial to verify the eradication of the infection and make any required modifications to the treatment. Trichomoniasis. Clinical manifestations. Trichomoniasis is a sexually transmitted infection that results in the production of frothy and malodorous discharge, accompanied by genital itching and discomfort during urination or sexual intercourse. Acidity pH level. The pH level of the vagina may rise, generally exceeding 4.5. Examination, over-the-counter, OTC testing for trichomoniasis are unavailable. Diagnosing the condition necessitates laboratory procedures, such as a wet mount or nucleic acid amplification tests, NAATs. Treatment. A. Acute infections. Administering a solitary dosage of metronidazole or tinidazole is typically efficacious. Recurrent chronic infections. Administer repeated therapy, possibly with escalated or extended dosages, and ensure that sexual partners receive treatment to prevent reoccurrence of the infection. Guidelines and subsequent actions. Condom usage can effectively prevent trichomoniasis. It is advisable to conduct additional testing to confirm that the infection has been eliminated, usually 3 months after therapy. General tips and follow-up care for yeast infections. Limit antibiotic use. Antibiotics can disrupt the natural balance of bacteria and yeast in the vagina, leading to yeast overgrowth. While antibiotics are sometimes necessary for treating bacterial infections, their use should be based on a doctor's prescription and guidance, limited to when absolutely necessary, accompanied by measures to restore vaginal flora balance, such as the use of probiotics. Screen for diabetes. High blood sugar levels can contribute to the growth of yeast. Individuals, especially those with recurrent yeast infections, should consider undergoing screening for diabetes or pre-diabetes, monitoring and managing blood sugar levels if they have diabetes, as well-controlled blood sugar can reduce the risk of yeast infections. Stress impacts the immune system and can make the body more susceptible to infections, including yeast infections. To manage stress, engage in regular physical activity, which can help regulate the body's response to stress. Practice relaxation techniques such as deep breathing, meditation, or yoga. Ensure adequate sleep, as lack of sleep can exacerbate stress and weaken the immune system. Understand and address risk factors. Several factors can increase the risk of developing yeast infections. Being aware of these can help in taking preventive measures. Hormonal changes, fluctuations in hormones, especially due to pregnancy, birth control pills, or hormone therapy, can increase yeast infection risk. Consult with a healthcare provider for management options. Diet. A diet high in sugars and simple carbohydrates can promote yeast growth. Limiting sugar intake and focusing on a balanced diet may help prevent infections. Tight clothing and non-breathable materials. Tight-fitting clothing and materials that trap moisture create an environment conducive to yeast growth. Opt for loose, breathable fabrics, especially for underwear. Personal hygiene products, scented hygiene products, douches, and sprays can disrupt the natural vaginal flora. Use unscented products and avoid unnecessary vaginal cleansing products. Additional tips for prevention: cotton underwear. Wear cotton underwear and change out of wet clothes, such as swimsuits or gym clothing, promptly. Probiotic supplements or foods. Consider incorporating probiotic supplements or probiotic-rich foods into your diet to support healthy vaginal flora. Avoid harsh soaps. Use mild, unscented soaps for intimate areas and avoid overwashing. General tips and follow-up care. Personal cleanliness. Maintain a consistent regimen of proper personal cleanliness, avoiding excessive washing that may disturb the natural equilibrium of vaginal flora. Safe sexual practices. Employ contraception methods during sexual intercourse to minimize the likelihood of contracting sexually transmitted infections. Nutrition and probiotics. Consuming a nutritious diet and including probiotics into one's routine may promote vaginal well-being. Routine examinations. Consistent gynecological examinations can aid in the early detection and control of infections. Ultimately, comprehending the unique attributes of each form of vaginal infection facilitates more effective administration and therapy. It is essential to consult a medical professional for an accurate diagnosis and suitable treatment when experiencing any symptoms of a vaginal infection.